Hi, everyone. We want to welcome you. Thank you for participating in today's Zoom meeting with Sanofi Genzyme on the Pompe Registry. Let's go ahead and give maybe a couple of seconds for everybody to join and then started. All right, I think we've got a good number of people in. A few more people. All right. Thank you for participating in today's Zoom meeting on the Sanofi Genzyme Pompe Registry. Today's guest speakers are Joseph Bender with Sanofi, and he's the global head of Rare Disease Registries. We also have Danielle Don, who is the global operations and advocacy lead for Rare Disease Registries at Sanofi. And with that, I'm going to turn it over to Sanofi and we will get started. Thank you.
Sounds good. Thank you, Tiffany. It's a pleasure to be with you all here today. I guess 4 days shy of International Pompe Day. Sorry, it'll take me a second here to share my slides. Hopefully you can see them. Thumbs up, good. So this is actually one of the favorite parts of my job, is to have these kinds of discussions with patients and patient groups. So again, appreciate the invitation to spend some time with you. We want to accomplish two things in our talk. The first is I want to talk a little bit about the background of the rare disease registries. I know that some of you have known the registries for many years, and some of you may be new to the registries. So I want to make sure that everybody has a sense of how we got to where we are today. And then for the second part of the program, Danielle's going to tell you about some really exciting patient initiatives that we have going. So with that, I will go ahead and move to the next slide. Maybe, let's see. Okay, there we go. So the story starts 30 years ago, actually. And as those of you who have been part of the Sanofi and Genzyme family for many years may know that we are a pioneering leader not only in real-world evidence, but in lysosomal storage diseases. That was one of the main focuses of Genzyme prior to the acquisition by Sanofi. And a lot of this work started in the 1980s with Gaucher disease. People like Roscoe Brady and others really trying to find a way to synthesize enzyme to replace the missing enzyme. And this work expanded in the 90s and the 2000s into the other lysosomal storage diseases, Fabry, Pompe, MPS 1. What you see on the screen here is a screen capture of the paper that was published in the New England Journal of the 12 patients leading to the approval of the very first enzyme replacement therapy in the world, which was Ceridase, and that was for Gaucher. But as you can imagine, on the right-hand side here, we see some of the questions. So this was a very small study, clearly. There are many more questions that the community had. There were many more questions that the regulators had, and I'm sure the patients had. And so the early leaders of Genzyme decided upon designing a study that would enable us to have many, many more numbers of patients participating for longer periods of time in order to gather the information to address these questions. And so as you can see, we have 30 years of experience in being leaders in this field of generating real-world evidence and real-world data. And when you bring all of these registries together, it represents the largest database for lysosomal storage diseases in the world. So to give you a sense of the scope, you can see here on the right-hand side, there are actually 4 registries, one for Gaucher, one for Fabry, one for Pompe, and one for MPS. And on the left-hand side, you see that we're in 68 countries across the globe. As of today, we have enrolled over 18,000 patients at 910 sites with the efforts of 1,250 healthcare professionals and the addition of 9 sub-registries. So this is a timeline showing you the sequence of events in how we got to today. So starting with the first patient being enrolled in the Gaucher registry in 1991, followed by the Fabry registry in 2001, then MPS 2003, and the new kid on the block in 2004 is the Pompe registry, and we enrolled our first patient in that year. As you can see, staying on the top part of the timeline here, as of today, we have over 2,200 patients enrolled in the Pompe registry. Looking at the bottom part of this graph, you can see that just one of the contributions that you've made by sharing your data with the registry is that we now have registry data that were used to support newborn screening for Pompe disease, and that happened in 2015. The other thing you can see at the bottom of this graph is that the registries have been very busy in sharing the data that we gather. So you can see from our first registry publication in 1996 all the way up to a couple of years ago, we had our 90th publication. This is a graphic of the Pompe registry, and you can see here, based on all of the flags, the global reach of this study. We're in over 44 countries around the world with 241 sites and 2,288 patients enrolled in the Pompe registry. As you can see here in the graph on the lower left, the majority of our patients are from Europe, Middle East, and North America, but there is a healthy cohort from Latin America and Japan and the APAC region. The objectives of the Pompe registry, as you can see, are to inform on the optimization of patient care. So that's characterizing and describing the natural history of Pompe disease and to evaluate long-term effectiveness of the treatments for Pompe disease. On the right hand here, you see some of the publications that have come from the Pompe registry. And I won't go into a lot of details, but I want to show you the breadth of what the publications cover. And these are all in peer-reviewed journals, which you probably know is the highest standard for the sharing of scientific information. So you can see here from the first publication in 2011, looking at scoliosis in Pompe disease patients, looking at some of the methods used in the registry, followed in 2013, looking at the timing of diagnosis of patients with Pompe disease. 2014 really focused on the methods of diagnosis. And then lastly, in 2019, looking at some specific populations in China, and then looking at some of the variants and phenotypes that we see in patients that are in the registries. So what is our vision for the registries? That is really our overarching reason for being, and that's to increase access to the expertise and solutions that improve the patient journey. And you'll see in the next few slides what we mean by that. And a lot of people ask, well, what are registries versus clinical studies? Well, if you remember back to my first slide, clinical studies typically, particularly in rare diseases, have very few patients enrolled, and they can answer very specific questions, and they're designed really to demonstrate efficacy and safety for regulators to be able to approve a product. But there's also a need, as you saw from my first slide, to answer a lot of other questions. Is what does this disease look like over a long period of time? What do the outcomes look like for treatment over a long period of time? And how do you gather more patients together into one study? And so registries do that. It provides this infrastructure that allows us to aggregate longitudinal real-world data. And it really helps in our understanding of the rare diseases. And ultimately, the goal is to help improve patient care. So here we want to take a specific look at the setup of the Pompe Registry. So the registry is a multi-center international longitudinal observational program, and it looks at natural history and outcomes in patients. And it really is a disease registry. So it's not product driven. It's not about any specific product. And as you can see in the second column here, any patient that has a confirmed diagnosis of Pompe disease is eligible to participate, regardless of treatment status. Again, to my first point about it being a disease registry, patients don't have to be on treatment, or they can be on any treatment at all. And patients can even be enrolled into the disease once, even after they have passed away. In the third column, the registry is non-interventional. What that means is the registry gathers data based on standard of care. So whatever the clinicians in a community are doing to treat patients is what we collect. So it's not like a clinical trial where an intervention is part of the protocol, where it's required that you receive a treatment or a placebo. So this is great because it helps us understand what the local picture is in the treatment of patients, where there might be gaps, where we need to generate evidence to help address those gaps. It's also important to note that participation is entirely voluntary, so it does not influence access to treatment or care for patients. In the last column here, just a couple of words about the types of data we collect. So we collect both retrospective, prospective data, information on disease signs and symptoms, information on treatment, clinical assessments, PROs or patient-reported outcomes, and that's one of the things that Danielle will be talking to you about, and familial linkages. So the registry is not just a study. It's a way of connecting the community. And so here we have some viewpoints from various folks involved. Here you can see on the left-hand side the importance of having the registry in communities that are yet developing, because they may not have a platform or infrastructure for being able to share information. So it's important to have a global program that those sites can plug into. Here in the center, you see from one of our registry physicians talking about the importance of the registry as a resource for understanding rare diseases in general and how this can help inform public policy. Lastly, and most importantly, you see from a patient's perspective, particularly with rare diseases where there just aren't a lot of patients, or you may not be aware of other patients, you can sometimes feel alone. You don't want to be feeling like you're the only one out there. And the registries provide a community and a way of other patients understanding that there are other patients like them and that they can help contribute to the education and improving outcomes for not only themselves, but for their patients cohorts around the world. We always like to think of the registries here on the right-hand side as contributions from patients for patients, because without you participating, the registries will not happen. They don't work. So it's a really foundational element of the registry. You can see here on the top part of this graph is that the whole process starts with the patient giving their consent. Once that happens, then the clinical study personnel at the site, you can see here in the lower right, input the data into the database, which undergoes cleaning and analysis to generate the outputs. And as you can see here on the right, the outputs are extremely useful for the community, not only to providing evidence to improve disease and treatment knowledge, but to address questions that regulators may ask about reimbursement, et cetera. As you can see here in the center, for patients that would like to participate, there are no additional costs, no additional visits and tests beyond what the standard of care is. As I mentioned a couple of slides ago, you're able to withdraw participating at any time. There is no influence on therapy or care because it's a disease registry. And the data are used for proof purposes only. And that's a hallmark of these registries. The privacy is extremely important. Holy cow, let's see here. Having trouble, there we go. Okay, move to the next slide. So this is a nice way of looking at the entire organization of the community around the registry. So you can see your front and center patients and patient organizations. As I said, without you, this doesn't happen. But you can also see to the left and the right, there are other key stakeholders in this picture. So payers, regulators, and policymakers, of course, need to approve products and approve new products. And then physicians and coordinators on the right, without whom these data would not get in. And as you can see, all of us together working in concert to increase the knowledge about the disease and treatment, to serve the disease community's needs, to optimize disease management and support, again, those commitments or questions that regulatory authorities have, health authority may have as well. So I want to talk a little bit about some of the contributions that the registries have made over the years. I think primarily, I've already mentioned publications. So these are key ways for us to understand and share knowledge to treaters and patients. And Danielle will be talking a little bit about that in a couple of slides. But at congresses, with posters, regulatory reports that we submit to regulatory authorities, and questions that the community of physicians has, and they have a way of being able to ask those questions of the registries, and that helps generate, again, more ideas for publications and dissemination. So you can see here on the left-hand side, increasing disease knowledge, ultimately leading, hopefully, to improved patient care, addressing questions that regulators have, helping secure reimbursement, which is a really important issue that all treatments struggle with. Supporting healthcare policy formulation. So we regularly give comments to draft guidances from regulatory authorities, healthcare authorities, because there's more and more realization of the importance of real-world evidence. And so we like to share our 30 years worth of pioneering and knowledge to help drive understanding the importance of the information that comes from these registries. And of course, lastly here, maintaining access to therapy and facilitating community connections. As I said, it's not just a database and a study, but it's a way to help connect the community. One of the ways we do that, particularly for Pompe, is from newborn screening. We might have parents asking their physician, we understand now we have this, but what does this mean, for our child? So we're able to connect the physicians so that they can talk directly to one another, again, to help address some of these questions. So that's kind of the end of this section about the background. And now I will turn it over to Danielle to talk to you about some of the exciting patient activities that we have ongoing.
Thank you, Joseph. You go to the next slide. Great. And I wanted to start my section here with a number of the patient initiatives that we are working on through the rare disease registries. And I guess I want, just by way of introduction and making sure you know where I'm coming from. So I am a genetic counselor by training and used to work with lysosomal storage disease patients, as well as many other metabolic disease patients. And when I moved over to working on the rare disease registries, part of what was important and what we've continued to hear is that we want to find more ways to connect with patient communities. And we want to make sure that there is more communication and more understanding with patient communities directly. And again, I think, as Joseph really nicely pointed out, again, this 30-year history, the world of rare diseases has changed. The ecosystem has changed. The landscape of data collection has changed. So we want to continue to ensure that we really are working with all of our stakeholders. And one of the most, again, important stakeholders are all of you in the patient community working within the rare disease community. And so where we again, about 3 years ago in 2019, we actually had our very first registry patient council, where we convened patient advocacy leaders at the global level and at local levels, and heard lots of feedback of how we can be working together with patient communities, and what else we need to be working on. We want to continue to hear that kind of feedback. And from that, over the last couple of years, we have been working hard despite the pandemic and despite not being able to physically be present together. We've been working virtually on many, many different initiatives, and I'm here to tell you a little bit about a couple of them today. But again, starting with the Registry Patient Council, this is something that we want to continue, and actually just had our second Registry Patient Council about a month ago. And we are working with, again, all those multi-stakeholders within different patient communities, and giving feedback and listening to sort of the next steps of things we're working on. One of the other pieces that we're going to talk about is having patient advocacy leaders at our registry board of advisor meetings. This was something that was, again, a direct ask from patient communities, and something I'm going to tell you a little bit more about our pilot and now our working forward with that. The third one is plain language summaries of registry publications. Again, ensuring that we are hearing that registry patients want to know how their data are being used. We want to make sure that patients are aware that, again, as Joseph said, the registries don't exist without the patient data that are provided by patients and their caregivers. So how are those data being used? And this is one way that we're working towards making sure we're communicating that back to patient communities. And then lastly, we're going to talk a little bit more about the digital innovations that we have to increase patient participation. I think there are, again, lots of changes that have been made over the 30 years. We started with paper-based registry data, and we've come extremely far, but we have more to go to find and continue to make sure that we are tapping into all the ways that we can leverage digital innovations and make sure that patients are connected to the registries. So next slide. Got it. Okay. So the first, again, the first initiative I want to talk a little bit more about are the importance of having patient advocacy leaders at the registry board of advisor meetings. So what are these board of advisor meetings? So this is actually a foundational piece of the 4 rare disease registries at Sanofi, that we ensure that we have boards that consist of independent physicians that have scientific and clinical expertise, which their sole purpose is to provide strategic guidance and advice on the research and the publication priorities. This has been a part of each of the registries since they began. And I can show the graphic here shows that there are both regional boards of advisors that are looking at specific topics and questions and research questions that are coming up for different countries, different communities, different cultures. And then we also have their roll up to an international board of advisors that are, again, looking holistically at sort of global questions that affect all Pompe patients, and think about how to prioritize the research questions that are being asked of the registry data. And these boards are really and have been the liaison between the Sanofi registry team, the internal team, and the rare disease community. And again, with the idea being that we want to ensure that there's a network that has both, regional and local, as well as global research needs that are being addressed. And what we realized and we heard from the patient communities is that it is high time to have patients who are also a part of these board of advisor meetings. It is critical that patient advocacy leaders are bringing the voice of the community to ensure that the perspectives are being heard at these board of advisor meetings. So in 2021, we initiated a pilot where we had a patient leader come to the International Pompe Registry Board of Advisor meeting and plan, again, as these are annual meetings. Each of the groups meets once a year. That we really have had a significantly positive experience by the entire board in ensuring that that a patient is at that board meeting, and is also, again, making sure that the patient community's voice is there and being heard as a part of it. So we again plan again in 2022 that will continue and will continue into the future to make sure that patients are a part of that process. Okay, next slide. And the second thing I want to talk a little bit more is share just a brief overview of some of the digital innovations that are coming to increase patient participation. So again, this is in direct feedback from patient communities that we've heard that patients want more understanding and want to participate more in the registries. So what we've been having our team work very, very hard on, and we will be kicking off hopefully in the next couple of months, is having a patient portal. So having patients have the ability to have their own account that they can sign in to the Pompe Registry, or all of the registries, but for the Pompe Registry, and to be able to enter their own patient-reported outcomes data. So we'll be piloting one of the patient-reported outcomes that we use, which is the SF-36, and that will be the first thing to start off with. But we anticipate and have plans as we move forward throughout the year to move all of the other patient-reported outcomes to having them entered electronically as well. So again, this will hopefully engage the patient community and all of you, if you participate in the Pompe Registry, to be able to access the dashboard, to be able to enter your own data for the PROs. And then we're, again, hoping and thinking about expanding toward having patient reports that would be available for you to view your data in a graphical format that's currently available through physicians being able to download that for patients. But we also want to be able to have that available directly for patients as well. And then there'll also be a library function. So again, trying to be able to make sure that patients know what the registry is, what's available, and have a place where content from the registry can be put there directly for patients that participate. We also are moving forward probably nearer to the end of 2022 with having electronic consents to be available. And this is a really important step because, again, as we're moving through the pandemic and moving through ways that patients want to be able to virtually engage, and being able to consent to the registry would be one important way to be able to do that. So we're moving forward with having electronic consents wherever that's available, which may not be able to be available in all locations, all countries, but where we can, we will be moving forward with that. And then the last thing that's on the right-hand side, which is again a little bit further out, but is something again I think would be something I wanted to just again bring up and talk about, is that there are augmented reality potential for registry data. So this is that there will be assessments that could potentially be done for range of motion, for walking, for movement, that can be captured in an anonymous way and uploaded directly into the registry. So again, trying to think about more innovative ways to engage patients to directly enter data into the registry, I think again can only hopefully again benefit both patients as well as the research community as well. And next slide, Joseph. And then one of the other important ways, again, that Joseph has spent some time talking about and how all of your data is used by the registry is, again, in manuscripts. And this is one that I guess just wanted to point out as would not be possible without a large cohort of international patients to be able to understand more about the disease. So this is a paper that was published in 2019 and was really about all of the different variants that are in the GAA gene that are reported in the Pompe Registry. And it really, again, it's a really meaningful paper to look at the indication of the severity of novel variants and assist physicians in the diagnostic practice and patient outcome prediction. This was published in a journal called Human Mutation, and after a year, it was one of the most downloaded articles from this journal. And it also was selected by the editors of Human Mutation to be a part of an editor's choice, which again was just trying to make sure that that it was clear this was a paper that was impactful, that was meaningful, and again is only possible because of the patients like yourselves who are participating in the Pompe Registry. And even, again, it had been published at the end of 2019, and even within 2 years, it's been cited 17 times since its publication. So again, that's something that, again, it's really meaningful in a lot of ways to make sure that that data is getting out there back to the community as well. And next slide. And so from this, what is, again, a paper like this, which again, in the clinician community seems to be being used, is being used far and wide. One of the important ways that we really heard was important for patients is to also have plain language summaries of publications and the data that are coming out of registries. So we'll take a minute just to talk about what is a plain language summary. So a plain language summary is important. It is not a lay summary. It's a plain language summary that explains medical research in a clear and understandable way. So it's, again, it's making sure that at an appropriate health literacy level, data are being explained. And most importantly, and again, I think meaningfully, that plain language summaries are visually enriched summaries that don't just use text, but use infographics to explain the research article. And what we also heard was, again, loud and clear, that plain language summaries will be useful for patient advocacy groups to understand how the data are being used and for the rare community. I think also importantly, and again, as we're moving forward and learning more about plain language summaries, is that plain language summaries aren't just for patient communities either, patients and their families. They're actually also for non-specialist healthcare providers. So I am sure that this is not an audience that I need to mention how many specialists any Pompe patient has, that any lysosomal storage disease patient has. So not every physician is an expert in every aspect of the disease. So again, we also are hearing and understanding that plain language summaries are important, again, for more than just a single community member, but for many, many different stakeholders. Next slide. So we are moving forward. Oh, sorry, and right before I finish that, so we are moving forward with a plain language summary of the GAA variants manuscript. So this is something, again, we are working towards having open access to be available to anyone. It will have translations as well, and we will, be back in touch with all of you when this moves forward and this initiative continues and when it's published. So more to come on that one as well. So yes, I can close there and give it back to Tiffany.
Thank you.
Thank you so much. So if you have any questions, please use the Q&A feature at the bottom of your screen. And we already have a couple. The first one is, how many publications have there been specifically from the Pompe Registry?
Yeah.
There have been 7 of them. Okay.
Yes.
Another question we have is, given that you're the number one of a registry database, Joseph said, and that the registries are sharing data, that there are family linkages, even posthumously, why can't I access my son's registry information, which he signed twice in 2006 and 2007? So I guess the question was, is there a way to access her son's data now that he's deceased?
Yeah, I would say, yeah, go ahead.
No, it's a very good question. And again, through the registry physician, patients are always able to access all of their registry data. Again, up until this point, it has always been through the registry physician, and you can have a report printed out, or you can have an Excel spreadsheet printed out of any of the data that have been entered for yourself or your family member. And again, as we move forward, and we are implementing ePro accounts. That will be something where registry participants themselves can sign up for an account, and then we'll be able to access both entering patient-reported outcomes as well as moving forward and accessing reports of your own registry data.
So there's comments to that question saying that accessing registry data through the physician can take months, and this particular patient was not able to get an Excel spreadsheet, like you said, or a printout.
I'm happy to take that back and separately, but the functionality through the physician is how it's currently set up and should absolutely be available without months of waiting. So maybe that's something I can give a little bit more. Sorry, Tiffany, go ahead.
Yeah, perhaps that's something to address with the physicians that are enrolling. They need to give feedback when it's requested.
No, and again, this is the kind of important communication we want to hear, this kind of feedback, because again, if things are happening for one patient, that might be happening for another patient, and it might be that the functionality isn't clear to a specific physician, and or maybe there's something being lost in translation. So I certainly want to hear that kind of feedback so we can address it.
Yeah, let's take it perhaps a step back and say, how do patients register? How do they participate in the registry? Can they register themselves?
Another great question. So currently, patients need to register through registry physicians. So at this point, patients themselves can't register without being associated with a clinical registry site. And that is, again, because of the way that these are observational studies and the way that they're set up. But again, as we move forward and we're looking towards having electronic consents, that's something we would like to also move forward, that patients can connect to registry physicians and be able to do that again remotely with an electronic version, instead of the way that currently they have to do that with in the hospital in a clinic setting with that physician.
Okay. And there is a patient offering to help with that, to share his experiences on the months in the chat feature if you want.
I'm sorry, I hadn't had the chat open.
So another question, how many PhDs have you been working?
I'm sorry, I think I missed the end of that question. My headset just went a little funky.
Yeah, it froze a little bit.
How many patient association groups have you been working with, PAGs?
Oh, so for the patient council, we have 11 different patient groups across, again, both local, regional, and global groups. We also are working, again, Joseph and I are spending more time in these sorts of patient group meetings, because over the last few years, I don't think we have done as many as we can do. So we are, this year, we've already had 3, Joseph, in the last couple of months, and have more planned to come across all of the disease states and all the different patient groups.
Do participants in the registry have any control over how their data is used? So for instance, can they opt in to be used for one type but not another?
It's a good question. Joseph, do you want to take that one, or do you want me to take that one?
Yeah, sure. No, happy to. So we don't kind of divide up the data into different pieces. So patients who want to participate for the whole registry. So it's not kind of divided up into separate parts. But the consent is very clear about how the data are used. So if that particular scope is not acceptable to you, unfortunately, then you wouldn't be able to participate. But it's very strict, and it says exactly what it's used for. So in that sense, you certainly would only sign up if you're comfortable with that. So that's my long-winded answer. There isn't a way to kind of parse different parts of the registry to sign up for. I don't know, Didi, if you had anything to add, but that's.
No, and the only thing that I would say is an addendum or as an add-on to the consent is, again, for Pompe disease especially, that some patients want to consent to having their own their own data linked to a sibling, linked to a cousin, linked to somebody who they're related to, where others may not. So that is one piece where that's an option for patients who are related, but that is something you can also opt out of.
Given that at this point, you have to be registered through your physician, how do you know if your physician has, one, registered you, and two, is timely providing updates on your information?
So if you have consented, again, so the Pompe Registry is an observational study, just like any clinical trial is an interventional study. The registry is an observational study. So if you have enrolled in the registry, then you would have had to go through a consent process with your physician. So that's how you would know, is working again with your physician. I know that there are certainly families and certainly individuals who may have registered, who have signed up and consented years ago, but again, haven't had any connection back in a while. So that would be, again, something to go back to your registry physician and go ahead and ask for, first of all, you could have reports in the data that you have provided to the registry. And again, hopefully in the next couple of months, we'll be able to also have your physician then help you get an account to be able to connect directly with the registry. So that's one of the keys to ensuring that we're connecting back with the registry patients that are consented. And Joseph, anything else?
No, that was perfect. So, you will not be enrolled without knowing about it. The physician can't do that. So they need to have a conversation with you. You need to be interested. And then, as Danielle said, you sign an informed consent, explain the study to you, and then you decide. You're in control.
The question we're geared to, I want to do it. How do I know my physician is, I guess, uploading my data annually or whenever I have testing done?
That's a very good question. So I would encourage you to have that conversation. So as you can imagine, with an observational study, a real world data, because there are not scheduled visits, the data entry sometimes can get behind. So you are in a great position to say, I am contributing my data. Can you please make sure that it is entered? I think that's a very reasonable thing to say. So there's no way to guarantee it other than if you ask for the report and you don't see that your data in there, I would ask about it, because the way this is a success for all of us is to have as much data as possible. And if you're taking the time to making sure your data are contributed, they should be contributing to that goal. So I think it's a great question.
Okay, another question was, Gaucher around the registry achieve the vision of increasing access to improve the patient journey?
Sure. So that happens in a lot of ways. So more and more health, what are called HTAs, health technology assessments, are asking for long-term data about, and again, this is not just limited to Pompe disease and Pompe treatment, it's all rare therapies, to understand why they should still be providing drugs. This is mostly in many cases, where you have a nationalized health system. And so the data from the registries helps them understand how important it is that you continue to provide therapies to this group. The other, one of the other pieces too is helping understand the natural history of a disease, understanding where there are gaps in when a patient is diagnosed to when they are treated. So in all of these lysosomal storage diseases, there's oftentimes a really unacceptably long patient odyssey to try and get a diagnosis. So those are some of the ways that that registries help contribute towards improving those outcomes.
I guess I would also, Tiffany, I would also chime in for the answer being, especially for all of you in the U.S. So being newborn screening being such an important piece of moving forward and trying to identify patients earlier. And again, in 2015, registry data was part of the package that was used to lobby for Pompe disease to be put on the recommended uniform screening panel. Again, it's just a really important thing. And as an anecdote of something that, again, is something that the registry does, but it isn't something that, again, we talk about often, but we get requests from physicians who are participating in the registry who want to know if the registry among the thousands of patients has a specific genotype. And often this is related to having a patient who's had a newborn screen and trying to understand a little bit more for the family who is coming in and has a baby with maybe a variant that hasn't been seen before by the lab that's done the testing, and to try to find, again, ways to find and look in larger databases to see whether there's any information that's available. And again, it doesn't happen all the time, but it certainly happens enough that we're able to connect physicians to potentially that one patient who is in the registry, or at least, again, provide whether there are any other patients with a specific looking at genotype, phenotype. So again, it's a sort of specific clinical care where I do think that can have a real impact for the physician and the family who are looking for information when they're requesting it.
Thank you. Wait, here's another one. I am contemplating moving soon. And how do I make sure that my registry data follow, because I'll be having a new physician when I move?
This is one where it actually happens more often than you think. This is actually a regular occurrence globally for patients who transfer from one registry site to another due to a move, and can happen, again, in Europe, we see it going across borders. Again, in the US, it happens a fair amount. There is a way when you are with a registry physician in one location and to move to a new location, to a new registry physician, you will also need to go through the consent process with the new registry physician. But there are system checks in place to ensure that any patient doesn't lose all of the registry data that's already in the system, that it will do a duplicate check and make sure that that data will transfer from your current registry physician site to the next site. So sort of a long-winded way of saying no data will be lost. Your registry data can follow you from site to site.
Another question that a patient had is, are you only registering your data as Pompe, or do you use data with other diseases that Pompe patients may have or have had immunity rates? For instance, if you have cancer, is that noted in the Pompe registry?
That's, again, also very important. So currently, there aren't other comorbidities that are collected in the Pompe registry. That differs between our rare disease registries. So whether there are known other comorbidities as well, but there aren't any others in the Pompe registry that are collected, like cancers.
Okay. I tried to talk to my physician about registering question, me and the registry, and they indicated it seemed too time consuming. Are there any incentives to encourage physicians to participate?
Joseph, do you want to take this one? This is one we've heard from other patient groups as well.
Yeah, sure. No, it's a multi-pronged answer. I guess one of the key things is that particularly now with some of the reports that will become available, it's a great way for physicians to be able to have a great dialogue with their patients because they can ask for their reports and see their progress. And then with some of the new digital innovations that Danielle's talking about, patients will be able to see their data. So I would say, you know, as a communication tool and engagement, that is certainly should be top of mind for physicians in potentially considering this, that, you know, this is one of the things that they can understand from the registries. I think also participating is that you become part of this global community. We've had many physicians who have been with the registry since the early days, 30 years ago. And it's amazing, you know, what they have been able to learn, but what they've been able to teach. So I would say, you know, becoming part of that community certainly is a really important thing. And I guess, you know, from a time point of view, you know, certainly there is support to the sites for entering data that's available. So that's a potential piece that could pretty easily be solved. So I would say, you know, there are a lot of reasons why when we have these discussions that we talk to physicians about why it's, you know, an important thing, a desirable thing for them to join the registry community. I don't know, Didi, if you had anything else to say.
Yeah, that's great. I agree with everything you said.
Okay, we just had another question. How can we open up the data in an anonymized way if need be, more broadly, to enable a higher rate of learning? It seems from slide 13 and the low publication count that the restrictions on the data not be fully aligned with the goal of increasing access to improve the patient's journey.
Yeah, so I would say one thing to keep in mind about this is the Pompe registry is the youngest of the registries. And so there hasn't been time to kind of amass more publications like Gaucher, for example, which was the first. I think we're always, yeah, it is true, but it's the baby amongst all of them. But I would also say that we're always looking at ways to make sure that the appropriate impactful data are communicated. So the board of advisors that Danielle mentioned are regularly sharing. One of their roles is as liaisons. So because they also participate in the registries and they enroll some of their patients in the registries, and they are in a perfect position to see where there are data gaps in the standard of care. And so they're able to actually address questions of the data. And so I think, you know, one way to increase that certainly is to have more dialogue around the gaps at the meetings. And that's something that does happen regularly. So I think it's, you know, it's not a simple answer, but I think, you know, there are ways in which we can increase that. It just, it takes time, unfortunately.
We have a few minutes left if there are any further questions from the community. But you said that the information shared around the world with subtitles in many languages. Can you tell me how I can share all of this information with the French Pompe group, please? And I'll take a stab at answering that one. This call is being recorded and it will be made available online. I believe some YouTube channels are capable of providing subtitles. However, I'm not sure about that from this, for this call, but over to Sanofi, do you have any material that can be provided to the French Pompe group?
So I just want to clarify, Tiffany, this is information about the registry, just about the just sort of like this sort of webinar? Is that the question?
I believe so.
I think, again, I think that having this available to the French group would be great. Again, I don't know about the translations of how we can do that, but that's certainly, again, having more connection wherever the groups are in the world, I think will again help and be helpful. So maybe we can take that offline and figure out how we can do that together.
Do you have, or actually relevant to all information, so do you have data and information that can be shared, I suppose, in French on the registry?
So one of the, actually, so the plain language summary that I was just speaking about, when that is published, it will be published in a number of different languages, and French is certainly one of them. So that's one, again, it's just the top of mind where we're working towards having more plain language summaries and having them translated into different languages. And I guess the other piece then I can also make sure that I go back to is the electronic PROs. So having patients who have accounts, any of the PROs will be available in all of the languages that are published. So for, again, the pilot of the SF36, that is available in, I think our last count was 200 languages, 150 languages. So again, this would be something patients would be going in and filling out in their local language.
Thank you. Are there any further questions? We have about 2 minutes left. I don't see any at this time, so, oh, okay, one more thing. Towards the time matters part. And if the PLS are deemed important, is there a way to speed up the process? This one we're referencing has taken 3+ years so far.
Great, it's a great question. So this is the pilot of the PLSs. This is actually, again, in direct response to hearing that this is what patient communities want. So these are the first we're doing. Moving forward, we do and will be working toward ensuring that we have ways to publish plain language summaries of manuscripts as they're being published. So again, this is the first, it is an ongoing project, but the goals being that these would be available as possible concomitantly with the publications of the registry data. So we're getting there.
Okay, well, thank you. And with that, I would say if there are any further questions, to please feel free to email the AMDA and we will pass that along to Danielle to get your questions answered. And so again, we'd like to thank, on behalf of the AMDA, we'd like to thank Sanofi and especially Danielle and Joseph for participating in this webinar. And with that, I will say thank you. And this concludes today's AMDA webinar.
Great. Thank you all.
Thank you.
Thank you.